Hello, everybody. This is Anne DeGheest, and this is my COVID weekly update on July the 3rd. My intention is to share the latest facts and scientific discoveries, not to cause fear. I don't want to get you depressed. I just want you to assess the latest information and empower you to make risk-adjusted decision to protect yourself, your family, and your loved ones. I need your help. I need you to help spread the word. I think we need to help educate other people through your friends and social networks so they can share this information. And really, we can build a COVID Social Responsibility Act. We really all need to take charge. This is not going to happen unless every American starts to be responsible. The same thing we did for drunk driving. We don't want to accidentally hurt other people. The same thing needs to happen with the COVID social distances and wearing a mask. So please share my weekly update on YouTube, which is called An Insight. I'm going to. So you can. This week we are going to try to break the 1 hour update into 2 videos, so it's easier for people to use. The first one that you're watching right now is going to be focusing on epidemiology from the worldwide all the way to the rest of the US and the state of California. The second part, which you can also find on An Insight, is going to be a second video called Clinical Updates and the latest information about reopening in America. For people on YouTube, my background is that I've been in the healthcare space for the last 40 years. And I run 2 companies, Health Tech Capital, which is an investor group that has invested in over 40 companies in the space, and MedStars. I've spent the last 30 years developing patient monitoring equipment for hospitals, including pulse oximetry, which I helped launch worldwide, which a lot of you hopefully have one at home to measure the percent of oxygen in your arterial blood. So let's start. This is the first part, the epidemiology part. So we're going to focus on what's happening in the world. The US has now passed Brazil in the highest amount of daily cases. For a while, if you remember, a couple of weeks ago, Brazil was ahead of the US. Unfortunately, we've passed them. We're growing at a faster rate than Brazil. India is now number 3 in the world, also on an ascent. And you can see Africa is coming up. We are now in the US in a situation there where the growth has been so high that it's too fast for us to control it. And we have had an upsurge in 42 states. If you remember, a few weeks ago, we were just at 2 to 5 states that were on the upswing. And we have now passed 52,000 cases per day. A week ago, we were at 40,000 cases per day. As a result of that, it's starting to put pressure on hospitalization. Remember, there's a 3 weeks delay from the time we have an increase in cases to the time people may end up in the hospitals or a high fatality rate. The second part of the video, which is going to be a separate video on YouTube, we're going to talk about clinical update. Please watch it. There's a lot of very interesting information on how the disease is progressive, the mutation of the viruses, which seems to be more contagious, the long-term effect of the disease that we're starting to learn, the fact that what's really driving the negative outcome is not age, but pre-existing condition. And we're going to talk quite a bit about mask and the reopening of the US. So let's look at the worldwide basis. We have close to 11 million cases. Probably by late tonight, we will pass 11 million cases. It's stunning. We have gone up 1.3 million in the last week since the last update, which is around 200,000 per day. And you can look at the curve here where there's absolutely no slowdown to the curve. US is unfortunately number 1 at close to 2.8 million cases, followed by Brazil, and Russia and India that's starting to catch up. So last week, we looked at the number of days it took for the world to have 1 million cases. Initially, it took 100 days. Now we're shrinking to 5 days. And unfortunately, it's going in the wrong direction. And so it's really worrisome because we're pretty much doubling, adding an extra 1 million cases in less than a week. If you look at the big hotspots in the world, which is the very red, dark red, which is the rise in the last 2 weeks to kind of smooth the ups and downs of the growth, you can start to see we have some issue there in the Middle East area there that's popping up that wasn't there before. Unfortunately, Africa is also getting darker in the colors. A few weeks ago, it was more on the lighter color. Part of that is now we're collecting data, and not all the data is, you can see some part of Africa, we're not getting any data there. Paraguay just came up, that's new. And unfortunately, Brazil and the US, and Australia has had a breakout. Let's look at the daily cases. If you remember, a couple of weeks ago, we're all bundled up in this area there. Now here the US, all by themselves, all the way on top, with 52,000 cases. I saw a quick announcement that we may have passed 60,000 today. I haven't seen the official numbers yet. We are now going significantly faster than Brazil, which has at 46 to 47,000 cases. And then the quick drop afterwards, is India at around 19,000 cases. So unfortunately, on a worldwide basis, we're clearly on a pandemic mode. There's no slowdown there. If you look at the death rate per 100,000, so it's normalized by the population there, Belgium is still the highest one if we look at the mortality rate, and we'll talk a bit more about that, which was 85 per 100,000. The US is 39 per 100,000, and which is a little bit below what was happening in the hotspot in Europe there, but higher than Brazil. So we need to keep an eye on the mortality rate. Now, most countries fail to capture the real number of death rate in the world. People have looked historically at the adjustment based on the history of what the fatality rate should be at this time of the year. And then the only country that seems to be reporting correctly is Belgium there. It is estimated that maybe we are underestimating by up to 50% the mortality rate in a lot of the countries. And you can see in the UK, for example, this is the ban from COVID. This is the actual mortality rate. Same thing in New York City there. So a study just came out today or yesterday from the New York Times, estimating that we're missing 120,000 deaths that were probably related to COVID. And that was probably a combination of being underreported or not being tested. There are some states in the US as well as some countries who are only counting people who have been diagnosed and tested for COVID. And so I think you should estimate that the mortality rate is higher than what's being reported. And you can look at the UK, for example, the big bump that they had, same thing for the US. And so not all countries, some countries, like Denmark and Finland seems to be reporting it accurately there. But it's unfortunately, the data needs to be interpreted country by country. Another thing that's continued to happen is the age of the people who are dying. If you remember, most of the European deaths were people over the age of 75 years old. What is happening in the US is that the average age is between 35 to 40 years old. And this is the fatality rate. So we are, around a bit over 5%. The younger, less developed countries there have even younger average age. And for example, in Mexico, 25% of the deaths are estimated to be between 25 to 49 years old. Now, the causes, we'll talk a little bit more about that. Part of that is high population density in some of this area there, more poverty, lower access to care. In the US, it could be due to the fact we have higher comorbidity that may be in Europe. So you have a younger population there that has obesity and diabetes that you may have in Europe. So don't assume it's if you're over 65 years old, these are the only people at risk. Clearly, this virus doesn't distinguish with age. It's distinguished by pre-existing condition, and we'll talk more about that. On a worldwide basis, Brazil is straight up. There is no slowdown in their curve. Mexico is the same. And unfortunately, we were going down in the US. Unfortunately, that was mostly New York, New Jersey. The rest of the country was really flat, and we went straight back up. India is also on the way straight up. So that's unfortunately because it's a very dense population. Countries, very large population. Peru, on the good news, it seems to have controlled the peak that they had, so that's good news. Russia is the same, and it looks like Chile also was able to control it. So congratulations to this country. Colombia, we need to keep an eye on them. It's still a low numbers, 4,000 cases a day, but it's clearly on the upswing. Worldwide basis, the World Health Organization is trying to have a target of 5% of positive cases. When you test around 5%, that means you have a pretty good amount of diagnostic that's being tested in the country. Not too much, not enough. It gives you a good idea of the population. When you start seeing a number like 39%, 37% of the cases are positive, it means you're under testing because you're probably testing people who show up in the emergency room with symptoms. The US is right over here. So we are unfortunately a significantly higher number than the 5% there. If you compare to Europe, you can see that Europe is doing a great job already coming back to normal. In fact, there's a big drop here. We have to see, what's happening with the data. But the US is clearly going straight back up. This is a study we talked several weeks ago, but I brought it back. This was a study done by JP Morgan, and they did the analysis of the infection rate per million, so it's normalized, compared to the culture of the society. And clearly in the US, we're a very individualistic society where, my right as an individual is more important than the right of society. And then you go to other countries, let's say like China and North Korea, to be the extreme, where the right of society is more important than the right of the individuals. And I think one of the challenges we're having is that when the authority says, please wear a mask and don't do certain things, in these countries, some of them are a bit totalitarian, people follow the rules. And unfortunately, we have been of a rebellious mode in the US. And I think that's one of the issues we have is a lack of federal coordination in having a higher rate. So it is interesting. It's not a perfect, correlation there, but it's clearly an individualistic versus collectivism attitude on following the rules that is having an impact on us. Let's look at the US. We have a lot of data on the US this week. We are 2.7 million cases. We have now grown from 40,000 cases a day to 53,000 cases a day. Today looks like it's going to be another high peak day. Look at the curve. It's clearly going straight up. The whole country is lightening up. The first wave is still this wave. This is not a second wave. The first wave was never kept under control. That wave is going straight back up. This is a graphic that shows in the darkest area there the most amount of cases per day. And you can see, Texas is getting more than 2,000 a day. California, 6,000. Florida is 3,000 to 9,000, depending on the area. It's clearly, unfortunately, going on the upswing. An interesting analysis is to look at the growth over a period of 2 weeks, because at times, the data reporting can be all over the places there. But if you average it over 2 weeks, you can really see the growth rate. And in yellow are the states that are clearly on the upswing for a period of 2 weeks. Clearly the South, unfortunately, North and Northwest now, where before it was just the southern part of California. And the East Coast is doing good. The northern East Coast is in good shape there. But some of the increases there is quite significant. We're doing now 774 cases per 100,000 in the US. And you can see some states like Arizona, Louisiana, and New York was, significantly higher than the average of the US. So we need to keep an eye on those numbers. We have been keeping track of this map, which shows the number of daily cases rising, again, looking at the trend over 2 weeks. And it used to be, if you remember, several weeks ago, 5 or 6 states. Last week was 33 states. Now it's 42 states. So unfortunately, the whole country is lightening up. And if you remember, we had nice green color, dark green here. They're starting to be a little bit more lighter. But clearly, this area now is all going into over the 100% rise in 2 weeks. And that, unfortunately, is the worst scenario. We really didn't want to be in this situation there. Idaho is up to 158%, Florida over 200%, Nevada 190%. These are very, very big numbers, unfortunately going in the wrong direction. This is an index that's being calculated by the White House task force. They have several index that they take into consideration. And the objective is to have, looking at the states who are trending poorly, and that's number of cases, positive case rate, hospitalization rate, there's a whole index that they calculate. And you can see that since we reopened around Memorial Day, we went red. It clearly is linked to the reopening. It's not doing more cases and it's not doing more diagnostics, it's clearly an outbreak. If you look at the 40-day changes, this is just as of today. You can see it's even darker than the old one I just showed. Florida went from 876 cases to 8,000. That's 10x in a period of 14 days. Georgia went from 700 to 2.4. Okay. Texas went from 1.5 to 6.3. These are massive multiples. California, unfortunately, we're also going up, not as bad as the other state, but we had a pretty high base, so we are now at 6,000 cases a day. So these are bad numbers because these are very high population state. Let's look at the ICU. There was some concern about the hospitals starting to be stretched. Rhode Island is starting to have some constraint. Georgia has had a very high raise. The ICU is getting to be elevated. They still have a lot of normal beds in the hospital there. But you can see Arizona, Tennessee, Alabama, as soon as you start getting into the 75 to 80% ranges there's not too much margin for be able to absorb a surge in the area there. Looking at the number of cases per 100,000, so it's normalized by the population, you can see that New York, of course, was the hardest hit when we had the wave in the March timeframe there, and as well as New Jersey and New York City. But now we start to have some of these numbers really going up, which wasn't the case before, of Arizona, Delaware, Maryland, Illinois. All these states, unfortunately, are starting to rise. We're going to talk a lot today about clusters, especially in the second video. And there are two major clusters that is just starting to come out in the news. One are prisons. If you look at the prison, there's 75,000 people infected in the prisons there. And here in the Bay Area there, we had 1,000 cases at San Quentin prison that just happened. And they're literally busing these prisoners all the way to Sacramento. I just talked to a physician who was taking care of some of those all the way to Sacramento there. The other area that's also not being talked enough about is the nursing home. They account for over 40% of the death. 12,000 nursing homes are infected. 282,000 residents and staff have been tested positive. They account for 54,000 deaths. And if you look at the state, this is the first time I've seen that, you can see the fatality, like in Minnesota, 77% of the deaths are due to people in nursing home. Not every state is reporting it. And so you have a couple of three or four states there, they don't necessarily separate the death or don't necessarily count the deaths from nursing home. So it's really important that we start to have federal unity in how we report the data. But some of the numbers, they are really high. New Hampshire is very high. Older population there, it's 80% are coming from nursing home. So we really need to be much more proactive in protecting the elderly in nursing home. Good news on the testing side. We went from 30 million to 35 million tests. California is leading the charge in the number of tests being done. Unfortunately, the positive rate is 9%. You're going to see different numbers depending on which data sets we're using, but it's clearly going up. And Texas is really, also cranking up the number of tests, but look at the difference in the number there. And some of the test rate we're going to see is all over the places in the country. Overall, this is another data set from Johns Hopkins. You can see that a week ago, 1 or 2 weeks ago, it was 4.7% of the tests. So that target of being below 5%, we were there. And now we have gone up to 7.4%. This is the graphic that shows, yes, we're increasing the number of tests, but the number of positive cases are going up, which means it is an outbreak. It's not because we're doing more tests. If you look at that 5% target, we've talked several times, we've now gone from 22 to 29 states that have gone up above that target. So it's not a couple of hotspots in the country, unfortunately. It's the majority of the US states that have the outbreak right now. It is spreading. It's like a wave going across the country. We have been tracking this R0, and the R0 is the ratio of how many people get contaminated by one person. And to keep the pandemic under control, we want to keep the R0 to be below 1. And we've kept track of this for the last 6 weeks, and you can see we've gone from 2 states, which were barely above 1, 6 weeks ago, to 40 states. Again, it's another confirmation that we're not controlling the infection rate across the country. And what's worrisome here is that this number here in Montana, Nevada, and all of that are 1.6. So these are a very drastic increase in the number. Looking at the hotspots, same thing that last week, a couple more hotspots in the Northwest here in Washington and Oregon. But it is the South and the Southeast that are really the hot area there in the dark red. Let's look at the evolution over a period of 3 weeks, which gives you a good idea of the trends. If there's a rise over 100% from week to week, it's the dark red, and we don't want to see dark red. Unfortunately, you can see that Florida has gone from around 1,000 cases to close to 8,000 cases in a period of 3 weeks. Louisiana went from 400 cases to 1,100, so that's like close to 3x. And South Carolina also 3x. So unfortunately, we're having a lot of very high growth. in the number of cases. So it's not a few isolated pockets. It's unfortunately, it's a wave across the states. The projection of the CDC was 150,000 deaths by the end of July, so in the next close to 4 weeks. They have been ramping up some of the upper part of the forecast up to 180,000. And we're talking in the next 4 weeks. And Dr. Fauci went on television in front of Congress this week, and he said that he could see that we're going to go to 100,000 cases a day. 100,000 cases a day is 3 million people a month. These are massive numbers. As a result of that, there are several travel bans that are happening. And so we're going to be living a very strange world. European Union has excluded the Americans from visiting the European Union. And that's because we have so many states on the upswing. Again, this graphic tells the story. Europe has been able, although, between countries to somehow coordinate their efforts and control. They had a bit of an uptick there, but they brought it straight down. Unfortunately, in the US, we have lost control, and we need to really do something drastic. The next few weeks are critical. We absolutely need to spread the word for people to wear masks and do social distancing. It has to be done at the individual level. In addition to that, we're starting to see bans inside the US. So New York, New Jersey, and Connecticut have banned now 16 states. Last week, it was 8 states. Now they have added 8 more states, including California, now has been banned. And they're putting some enforcement there with dollars, thousands of dollars fines. Yesterday, Chicago, it's a bit unclear how they're going to enforce this, that they're going to force a 14-day quarantine from all those different states. So it's going to be interesting that states now, because of lack of federal coordination, are starting to do the ban between states. So it is a little bit chaotic. Let's look at Texas. In Texas, I'm just picking a state. The good news, they have done over 2 million tests, but you can see the number of cases is clearly going on the upswing, and it's all the big cities in Texas, Dallas, Houston, San Antonio, and Austin. Clearly on the upswing, you can see the trend, was pretty controlled there, and then until they started reopening there, and it basically went straight back up. Most of the population are the carriers. This is a very important message to spread across, are the young people between 20 to 60 years old. They are the ones who are having these parties and going out, and unfortunately they spread the virus. Remember, 30 to 50% of the people are asymptomatic, and they may have very low amount of symptoms and not be aware to spread the virus. So the problem we're having in the US is the elderly population is really protecting themselves, but it's the 20 to 50 years old who think they're invincible, or they don't think they're going to be sick. And unfortunately, some of them could become sick, but more importantly, they are carriers and they're spreading the virus. California, unfortunately, is in a crisis also. Clearly, it's Los Angeles. You can see Los Angeles in the dark blue there. That's driving the number upwards, but we clearly have gone, since we start trying to reopen there, which is when you can really see the upswing. A drastically increased number of cases from around 2,000 to close to 8,000 now. So that's a 4x. As a comparison, you can see Oregon. I know some of you are from Oregon and the Northwest there in Washington. You can see they opened it up, but they controlled it. Same thing for Washington, a little bit of an upswing there, but nothing out of control there. Nevada, a little bit of an upswing, so we have to keep an eye on that. We have to see the trend continues downward. And Colorado is also doing a good job. So it can be done. Other states are doing it. We have now reached 200,000 cases. We had a huge number of cases, over 8,000 cases. We have to see some of the numbers because they go high and low. So let's average around 8,000 cases. That's a dramatic increase to where we used to be, which was pretty much around 2,000 cases, kind of a steady heady there. So unfortunately, as a state, we never peaked out. We never went flat. We continue to go up. As a result, California Governor Newsom has announced 19 counties, which is around 70% of the people in California, to have additional restriction until July the 21st for the next 3 weeks. We've closed the indoors public places like bar, restaurants, theaters, zoos, museums. They are recommending avoid gathering over the 4th of July. And this is what's a bit more worrisome, is the hospitalization has gone up 32%. And some part of LA are having some ICU capacity issue. If you look at the details by county, clearly it's the southern part of California. If you look at the case rate per 100,000, Imperial is around 3,561. And let me compare this to San Francisco, is close to 10x. The big differences on a normalized basis there. So the outbreak we're having in California is not in the northern part, of where we're having a little bit of an uptick. It's clearly in the LA and part of the San Diego area. So another way to look at this is that the positive rate has gone from 5 to 6.3%. So we're going up in California in the number of false positive. And most of them is in Los Angeles. You can see a very big difference between LA and the rest of the area there. Most of the Latino have a higher proportion of people are positive. And that's not because of the ethnicity, it's because they have to work outside. They live in higher density area there. So therefore they're at higher risk of being exposed. But here's the problem that we saw in Texas. Most of the people who are positive were carrying the disease are the 18 to 49 years old. We have to reach out to that population there. So please help me spread this video, because they need to be aware it's not for themselves, but it's they could be carrier for their loved ones, for their friends, or to a stranger, like a drunk driver could accidentally kill somebody else. Hospitalization has been going up. You can see the number of cases have been going up. So we need to keep an eye on that. The good news is it looks like we're able to take care of people outside the ICU and avoiding to have to use ventilators. But you know, we start to get a little bit tight on the number of beds. The Bay Area, we're having a little bit of an outbreak in Alameda, but otherwise, you know, it's not an explosive growth. If you look at county by county, Alameda, as I've mentioned, has had some issue there, including some nursing home. Marine, I think the problem there may be San Quentin and some pockets there. San Francisco is doing good, a little bit of an uptick. We have to keep there. Santa Clara, as you can see, was doing great. Is having a bit of an uptick. So all of them, we need to keep an eye on there. You know, I think that's why they're being restricted for the next 3 weeks. So I'd like to really thank all the subscribers on YouTube for your support. We reached 1,700 cases. Please help me spread the word. Go back to the YouTube and Insights to look at the clinical video, because we will be sharing a lot of critical information on new scientific discovery on how the virus propagates and how you can protect yourself.